I'm Lucy Smith, and I'm going to be doing a PowerPoint presentation on malignant melanoma along with Brianna Ballinger and Abby Novich. We want to start with an introduction to malignant melanoma. Melanoma is also known as malignant melanoma. It is a type of skin cancer that develops from a pigment-containing cell called melanocyte. Melanoma typically occurs on the skin, but may also occur in the mouth, intestine, and/or eyes. In women, it commonly occurs on the legs, and in men, it commonly occurs on the back. Melanoma develops from a mole with concerning changes in increased size, irregular edges, changes in color, itchiness, and skin breakdown. We want to look at the history of melanoma. Historical evidence of melanoma dates back or exists back 2,400 years ago. In 1787, Dr. John Hunter was the first surgeon to operate on melanoma. In 1804, Renee Lyon was the first to describe melanoma as a disease. In 1840, Dr. Samuel Cooper reported during the advanced stages, melanoma was basically untreatable. In 1956, Professor Henry Lancaster discovered that melanoma was directly related to the intensity of the exposure of the sun. And in 1979, a nonprofit organization known as Skin Cancer Foundation was established to educate the public. The incidence of malignant melanoma is 20 times more common in whites than African Americans. The risk of getting melanoma is about 2.5%, which is 1 in every 40 for white, and 0.1%, which is 1 in every 1,000 among blacks, and 0.5%, which is 1 in every 200 for Hispanics. Approximately 76,380 new cases of melanoma will be diagnosed every year. Approximately 46,870 in men and 29,510 in women. This is also incidence of malignant melanoma. This map shows the geographic information system mapping of melanoma mortality rate from the National Cancer Institute. The mortality rate for the United States is 3.84. The confidence interval is 3.8 to 3.88, and the number of deaths of 37,976, and that's through all of the 52 states. The risk factor of melanoma will include fair skin. In fair skin, you have blonde hair or red hair, light colored eyes, freckles, or sunburn easily. History of sunburns, which will include 1 or more severe blistering sunburns, which can increase the risk of melanoma. Excessive ultraviolet light exposure. Exposure to UV radiation, which includes sun tanning, tanning beds, or lights. Having many moles or unusual moles. 50 or more ordinary moles also indicate an increase of melanoma. Larger than normal size of moles, and moles that have irregular border and a mixture of color. Family history is also a risk of melanoma. Close relatives such as parent, child, or sibling that has had melanoma. A weakened immune system. Those who have undergone organ transplants. Risk factor of malignant melanoma include the A, B, C, D's of melanoma. The A is for asymmetry. Most early melanomas are asymmetry, which is a line through the middle would not create matching halves. Common moles are round and asymmetry or symmetrical. B is for border. The border of early symptoms are often uneven, and many have scalloped or notched edges. Common moles have smoother, more even borders. C is for color. Common moles usually are single shades of brown. Various shades of brown, tan, or black are often the first sign of melanoma. As melanoma progresses, the color red, white, and blue may also appear. D is for diameter. Early melanomas tend to grow larger than common moles, generally at least the size of a pencil eraser, which is 6 millimeters or 1/4 inch in diameter. E is for evolving. When a mole starts to evolve or change, you see water edge dermatology practitioner. Any change in size, shape, color, elevation, or any new symptoms such as bleeding, itching, or crusting is a sign of danger. Reducing the risk factor for melanoma. You need to minimize your exposure to the sun midday between the hours of 10 a.m. and 4 p.m. Apply sunscreen with at least a SPF 30 or higher to all areas of the body exposed by the sun. Reapply sunscreen every 2 hours, even on cloudy days, after swimming or perspiring. Wear clothes that cover your body or shade your face. You want to also avoid exposure to your UV radiation from sun lamps or tanning parlors. Parents with children under 6 months of age should severely limit their children's exposure to the sun. Examine your skin regularly and have your healthcare provider to examine your skin. Now this is Abby Novish with the pathophysiology of malignant melanoma.
Pathophysiology. Types of malignant melanoma include superficial spreading, lentigo maligna, acrolintogous, and nodular melanomas. Malignant melanoma occurs anywhere on the body, including your nail beds. Malignant melanoma mostly affects places exposed to the sun, but can be seen in areas not exposed to the sun. Melanoma affects mostly the middle-aged population, but can affect people of any age. Melanomas occasionally appear simultaneously with cancer of the other organs. Metastasis can cause melanoma to spread to other areas of the body, including other than the skin or your internal organs. There are many signs and symptoms to melanoma. The most common sign of melanoma is a lesion on the skin. Most of the time, these are lesions that have started as a tan, flat lesion that has been on the patient's skin for many years. Lesions can be irregular, raised, two-tone, or nodular. Lesions that are at least 6 millimeters in length, or lesions can be also painless or not painless. You may have a sore that doesn't heal, pigment, redness, or swelling that spreads outside the border of a spot to the surrounding skin, itching or tenderness to the site, changes in texture or scales, oozing or bleeding from an existing mole or blister. Most melanomas develop in areas exposed to the sun. They can also develop in areas that are also hidden from the sun. It is important to examine all these areas as well. You want to examine your legs, trunk, arms, face, and neck, also between your toes, underneath your nail beds, palms of your hands, and soles of your feet for blisters or lesions. Diagnosis is determined using a number of ways. A thorough history and physical examination. It should include a meticulous skin examination and at palpable of the regional lymph nodes. Family history is also needed to check for any first-degree relatives with melanoma. Biopsy results confirm the diagnosis of melanoma. An excisional biopsy specimen provides information on the type of melanoma, the level of the lesion, and the thickness of the lesion. An excisional biopsy specimen is sufficient for staging of melanoma in its early non-invasive stages. Incisional biopsy specimens should be performed when the suspicious lesion is too large to be removed safely without intensive scarring. Biopsy specimens obtained by shaving, curettage, or needle aspiration are not considered reliable proof of the disease. After a diagnosis of melanoma has been confirmed, you want to get a chest x-ray, a complete blood count, liver function tests, and radiculonode or computed tomography scans and performed to stage the extent of the disease. Prognosis. Prognosis depends on when the lesion is found and treatment is started. The prognosis for long-term or 5 years survival is poor when the lesion is more than 1.5 millimeters in length. A person with a thin lesion and no known lymph nodes are involved has a 3% chance of developing metastasis and a 95% chance of surviving more than 5 years. Patients with melanoma of the hand, foot, and scalp have a better prognosis. Those who have lesions on the torso have an increased chance of metastasis to the bone, liver, lungs, spleen, and central nervous system. Men and elderly women have a poorer prognosis of this disease. A diagnosis of malignant melanoma can cause anxiety and depression in any patient, especially if the melanoma removed causes a visible scar, such as on the face. Because of these, patients may have trouble performing their ADLs. Caregivers and healthcare workers can help decrease anxiety and depression in these patients by encouraging the patients to get up, find a support group, see family, and perform their activities of daily living to get back to a normal, healthy life. Next is Brianna Ballinger with ethical issues.
My name is Brianna Ballinger. I'll be discussing the ethical issues, the impact of the disease process, and the plan of care for the patients with malignant melanoma. Ethical issues. Ethical issues with malignant melanoma would include end-of-life care or the patient choosing to withdraw from treatment. If the patient chooses to stop treatments, as healthcare professionals, we must honor this choice and help the patient regardless of our own personal feelings. End-of-life care is also an ethical issue in which euthanasia is sometimes considered by the patient. This is something we must also honor. Healthcare professionals must be very sensitive to the wants and needs of these patients. Impact of the disease process. Malignant melanoma can be very devastating to family members and friends. When people hear cancer, they often think death. The The cure rate depends on how advanced the cancer is and what stage. In the best case scenario, the cure rate for malignant melanoma is 98%. This is usually around stage 1. In the end stages, like stage 4, where the cancer has spread to other parts of the body, it drops significantly to only 17%. Early detection is key to survival, along with education on the signs and the symptoms. Treatment is easily accessible with this type of cancer. Treatment depends on the stage of the cancer, but can involve surgery, medications, radiation, or chemotherapy. The cost of treatment varies greatly depending on how far the cancer has progressed. For stage 1, the cost can run anywhere from $2,000 to $14,000. Stage 4, the cost is anywhere from $34,000 to $152,000 per year. Insurance will cover the costs of the treatment of malignant melanoma. Cancer can affect everyday life events by making it very stressful on the patient. The patient will be very mentally and physically stressed. The patient must take time out of his or her day for treatments. And education, marriage, or having children are usually put off due to this diagnosis. There are many support groups that exist for people with the diagnosis of malignant melanoma. Some of these support groups could include Cancer Care, the Skin Institute, the Melanoma Foundation, and the Joanna M. Nicolay Melanoma Foundation. Problems. There are several problems that arise from having malignant melanoma that include impaired skin integrity related to excision of melanoma, risk for infection, inadequate nutrition, acute pain, anxiety, risk for fluid volume deficit, knowledge deficit, anticipatory breathing, fatigue, and risk of constipation or diarrhea. Plan of care. Impaired skin integrity. Medical management would include maintaining strict sterility during any procedures and keeping up with the patient's labs, especially the white blood cell count. Nursing management includes keeping the site that is impaired free of bacteria, with daily dressing changes and monitoring for infection. Nutrition also plays a role with skin integrity. If the patient does not have an adequate diet, he or she will not be able to heal properly. Risk for infection. Medical management would include taking antibiotics and keeping any surgical sites clean. Nursing management would include education to the client to maintain good hygiene and report any signs of infection. Inadequate nutrition. Medical management of inadequate nutrition will be to consult dietitians and make sure the patient has the right medications to treat any type of nausea. Nursing management will be to encourage the patient to eat and give nausea medications as needed to help the patient do so. Stressing the importance of nutrition in the healing process is also very important in the patient's care. Acute pain. Medical management of this would be to provide a prescription for pain medication. Nursing management of acute pain would be to give the patient the least amount of pain medication possible to prevent any possible addiction to narcotics. Try medications such as Tylenol or Motrin first before going to the narcotics will be beneficial to the patient in the long run. Anxiety. Medical management of anxiety on the cancer patient would include such things as prescribing a PRN medication to treat the anxiety. Nursing management of treatment of anxiety would be to educate the patient on different support groups that are available in the area and teaching calming exercises to the patient. Education on using medications for only worst case scenarios, so the patient doesn't always go to the anxiety medication, is also vital so the patient doesn't think they need the anxiety medication to be anxiety free. These are a list of our references.